Every year, 500,000 Americans undergo surgery for carpal tunnel syndrome. This is a risky surgery, but it's also a costly surgery. And it's costly in two ways. There are direct financial costs, which are the dollars and cents you have to pay, and then there are the intangible costs, which are the things many people don't think about, but in the long run turn out to be the most significant. Direct financial costs are averaged by the Bureau of Labor Statistics between open release surgery and endoscopic surgery. These costs depend on whether you have your surgery in a hospital or in an ambulatory facility. The total cost for surgery in a hospital is $5,377, and that's broken down into facility costs, doctor's fees, and anesthesia. The same surgery in an ambulatory center is far less expensive at $2,432, with a proportional breakdown in facility costs, doctor's fees, and anesthesia. The other costs associated with surgery are the intangible costs. Most people don't consider these, but in the long run turn out to be the most significant and the most life-changing. Surgery and recovery will cost you time on your job, and many people don't ever return to their former profession. Another intangible cost is the relatively high proportion of failed surgeries, requiring you to have another one or to do something else. This is one of the reasons why approximately half of people are unsatisfied with their surgery. Next, if symptoms recur, which they do in many people, you'll have to go through the whole process all over again. The struggle with insurance companies often makes life miserable, and they often deny claims on the first time around. And the average time from claim to settlement is 14 months. And finally, if you have carpal tunnel syndrome already, you have an 80% chance of having it on the other hand. And then you'll have to repeat the process all over again. So you have to ask yourself, is surgery really worth all of the costs involved? Not to mention the actual risks of surgery, which is another issue entirely. But of course, you don't need surgery if you get the Carpal RX, the proven and guaranteed way to get rid of your carpal tunnel syndrome safely and without surgery. And patients have been trusting it for years. That's because the Carpal RX is proven and guaranteed to relieve pain and other symptoms, and that guarantee is backed by our distinguished Scientific Advisory Board, and by research reported in the British Journal of Pain. In other words, the Carpal RX is the most effective and most trusted therapy for carpal tunnel syndrome. You'll be so thankful for Carpal RX because you'll be able to sleep again, without waking up. Order your Carpal RX now. You can order by phone or by visiting carpalrx.com. And every Carpal RX is guaranteed by doctors to work for you. You have 60 days to try it, absolutely free. So you have nothing to lose by trying Carpal RX except your sleepless nights. Get the Carpal RX today so you can sleep again.